Hey everyone, it's Dr. Rick, founder of Herbal 411, and I just received this from iHerb. I learned about iHerb from one of my patients in Norway, and as you have all found out, I'm not a big fan of Amazon anymore. I think that until they clean up their act as far as screening the third-party sellers, especially of vitamins, I just don't want to take the chance that my patients are going to be buying a possible counterfeit brand. And I'm sure there's bad people everywhere, maybe even on iHerb, but my suggestion is always, if you're using supplementation while you're trying to fix your nutrition plan and exercise routine, it's important to evaluate what your deficiency is and then supplement, but at the same time, don't go spending $1 million on an easy supplement that most third-party sellers and or companies should be able to give you for cheap. Now, if you're doing something for reversing disease, then I go with the Gusto as far as the best that you can find, and it's probably going to come at a cost. So I have some folks who are into diabetes and or into high blood pressure or coronary artery disease or multiple sclerosis. For those diagnoses, if you're taking a supplement of some sort and you're trying to really put the brakes on further suffering and disease progression, don't waste your money on crappy or entry-level, let's call it entry-level supplements. Go for something that's been proven. You can either ask me or you can go on consumerlab.com, and they do a fair job at evaluating most of the supplements that are out there. Now they have a smattering, a sampling of different supplements depending on, I don't even know where they buy their products from, but they buy their products just like Joe Public, and then they evaluate the batch. And if they find that the batch that they're looking at is advertising that's a certain amount on a nutrition panel of ingredients, and then the capsule that they evaluate in the bottle they buy, it doesn't have that, then they'll call the company to the carpet and say, hey, fix this. Or at least they'll give you a good idea about what's reliable, what's not. And in the case of moving forward, I think it's important to know that. But in the case of today's unboxing, this is on SAMe. SAMe is S-adenosylmethionine. And you've probably read about SAMe. I think I did a video before, but you probably read about it as far as mood. And it is now February. It's still cold, and the days are short, but they're starting to extend. In fact, the sun is shining most of the week, and some days of the week it's going to be shining all day, but there's always going to be overcast in Chicago. The question that some patients bring me is, can I take anything for mood? And I just did a really quick video yesterday because I was out on Sunday walking outside, and I did a quick video on seasonal affective disorder. And that's a very dominant mood disorder that's essentially major depression, but happens in a cycle of winter, usually October to March. And if it repetitively happens like that, as long as it's not intrusive to lifestyle or work or school, then we call it seasonal affective disorder. And the treatment of choice is usually going to be light therapy, in addition to, depending on how severe it is, medications and psychotherapy. The shortcut to taking care of that, or anxiousness and panic disorder and waking up middle of the night thinking, I'm going to take care of it tomorrow, that's called anxiety. The shortcut to taking care of mood disorder, whether it's depression or anxiety, would be this. I think that it's important to declare, what is the mood disorder? Is it dominant depression, or is it dominant anxiety, or is it a little bit of both, meaning bipolar? And I know those labels sound terrible, but you have to really figure out what your baseline is. And the diagnoses that we use as physicians comes off of something called a DSM. And the DSM is an old Bible of sorts that essentially puts all the diagnoses that most psychiatry groups and behavioral therapists use to identify deficiency and or a problem with a patient that's suffering. What we want to do is, if you identify that, then you can use the algorithm that has been established over several decades to treat that disease process. The SAM-E has been used in the past mostly for anxiousness, and whether it's generalized anxiety or panic disorder, the data that's been out on this supplement over the counter is strong. Now, you have to look at the proper places that the studies are. I like to use PubMed, and I think that's the NIH puts at least peer-reviewed studies on PubMed, and you can search on PubMed for SAM-E and mood disorder, SAM-E and depression, SAM-E and anxiety. Classically, it's for anxiety. I think that we're finding now that a lot of the mood disorders, whether it's depression or anxiety, they do get response from the same medications and supplementation or psychotherapy. Now, there are nuances there, so please take this information to your doctor and see how it pertains to you. This is not meant to be a substitute for medical care. So in the case of SAM-E, again, I bought it on iHerb. It was not too expensive. I chose Doctor's Best because the most recent review on Consumer Lab had labeled this as the approved and the most popular. And that they take into account pill size in addition to whether it has the ingredients in the capsule that's on the label. So they passed, at least with the batch test that was done by Consumer Lab. And let's talk about how to use this. So the cool thing, again, is it can be used for anxiousness or anxiety. It can also be used for depression. And the onset of action is very quick. If you use a prescription medicine, then typically it's going to be SSRIs or SNRIs. Those are the newer generations. And if you use that for a mood disorder, it takes about 3 to 6 weeks for effectiveness to start working. Because if you have any of the disorders of mood, it's usually going to mean that you have a deficiency of some hormone. And there's neurotransmitters and hormones that abound every day in a cycle where the hypothalamus stimulates the pituitary tells the glands of the body, the thyroid, the adrenals, and the ovaries, or the testicles to pulse and work and make either gonadal hormones like testosterone or estrogen, or adrenal cortex hormones like cortisol, or thyroid hormones. Now, in addition, the brain tissue also makes a lot of neurotransmitters, and the balance of endorphins and enkephalins, dopamine, epinephrine, norepinephrine, all those are very important for being balanced throughout the day to give you a fruitful day, a productive day. Sometimes when you have an imbalance from a trauma, and the trauma could be something as drastic as going into war, or family domestic violence, or getting into a car accident. Those are usually the triggers that turn on panic attack and generalized anxiety. Sometimes it'll be very subtle. It'll be non-intrusive. You can still work. It's just not severe. But a trigger might come along and really make it severe. And then it's interruptive of daily living, even sometimes in the form of depression, where sometimes a trigger is necessary. And it could be environmental, it could be a social, it could be a biological. If you have a diagnosis of sleep disorder and or cancer or heart attack, those things are also triggers for depression and or anxiety or any mood disorder. But bottom line is that if you have a trigger, then, and you also have a diagnosis, then we usually know the treatment plan. And if we use prescription medicines, there's usually an algorithm. If you want to try this and you're not as severe, but you want to try something over the counter, I think SAM-E is very good for either generalized anxiety or depression. The thing is, you have to understand that SAM-E, you have to obviously get the proper quality, but in addition, SAM-E, if you look at what Consumer Labs had evaluated, there are some supplement companies that sell it in a bottle. And the problem with SAM-E, there's a couple of problems. There's a couple of good things too. The problem with SAM-E is that the active ingredient, S-adenosylmethionine, reduces quickly when you expose it to air. That's why you have to have blister packs. I used to like Yarrow brand, but it hasn't been reviewed in a couple 5 to 10 years. And again, Consumer Labs did review several, including Doctor's Best, and they approved this. So I cannot make suggestions on Yarrow brand. I think I'll put a link to the old video I did. So these are individually these are blister packs. They're called blister packs. They have the prescription or the supplement in each of these blisters, and you just have to pop it out and see. Well, I just go ahead and do one now. Pop it out, and that is individually wrapped. That's the pill, and it stays in here so that when you open the pack up, or at least if you take one pill, the rest of the pills are not exposed to oxygen because they're still sealed. So that's why you have to have a blister pack, and that's why with SAMe, it reduces, and meaning it essentially degrades and becomes inactive when you expose the entire batch to air. So if you're gonna buy SAMe, start out with 200 milligrams. I'd usually do 200 milligrams daily for about a week, and then twice a day for about a week. Then you see how you feel after 3 weeks. If you haven't, that's the amount of time that you should notice an improvement, whether it's ability to sleep and not have an anxious attack or interrupt your sleep, or throughout the day. If your mood is not uplifted, which it should by 3 weeks, then you might want to increase the dose or change your brand. So increasing the dose, this also comes in 400 milligram capsule or tablets. And it's not that much more expensive, but you usually have to start out with 200 milligrams. Again, 200 milligrams once a day for a while, 200 milligrams twice a day for a while, maybe 400 milligrams twice a day to finish off and maintain. And with any mood disorder, well, with most mood disorders, the idea is if it's more depressive, you should maintain this even after you start feeling better. If it's anxiousness, you cannot expect taking one pill to turn off your anxiousness tonight. It takes a little bit of time before this basic building block for your neurotransmitters starts to make the factory, which is, they have a couple million to billion factories, all in the form of neural tissue, nerve tissue, and then all the mitochondria that work in the nerve tissue to produce the neurotransmitters that result in balanced mood. Well, it takes a while for a supplement to actually kick in and start producing the neurotransmitters that you're deficient with. So you have to give it some time, but typically 3 weeks is the amount of time. So if it still doesn't respond, then you have to talk to your doctor and or your functional medicine physician to see what else has to be balanced. Sometimes you have to also take rhodiola, you have to calm down with ashwagandha, you might have to take increased amounts of fish oil or omega-3 oils, vitamin D. So it's almost like a baby mobile. If you pull on one part of the mobile, everything gets upset or changes. And if you are off balance and you try to rebalance, you have to kind of take into account that other things might have to be manipulated. So this is the beauty of functional medicine, the beauty of what I do. And if you don't have your own doctor to help you navigate that ocean of change, then you can certainly ask me. I'll put my link down below. But the idea again is, if there is a better way than just white knuckling it and trying to make massive lifestyle changes, I think you can have an allowance of the shortcut, and this should fix things a little bit faster than you doing things on your own. I would always say balance with calming practice, some form of exercise, proper nutrition, and really good sleep. And if you're not too severe, you might be able to change things and change the course correct on your own with just those changes. You might have to get into a coach to teach you about nutrition, a coach to teach you about psychotherapy, a coach to teach you about how to exercise properly, because all those elements do help to make changes so that this body, this miracle, can produce what it has to produce to get you through life and have a good circadian rhythm, or at least a proper wake sleep cycle. So hopefully this gives you a couple of ideas. One caution though is that if you are bipolar, I mentioned that in the beginning, if you are bipolar, which is, you can look up the definition of bipolar, but it's when you fluctuate between depression and it's called mania, not necessarily anxiety, but mania or hypomania. Bipolar 1, bipolar 2, or cycling. The old term is cyclothymic, but if you do have that, you might actually take this and then bring on an anxiety attack or bring on depression. So you have to be careful. If there's a possibility of you having bipolar disorder where you can cycle between depression and mania, then please have your doctor evaluate you. And yeah, it's a little bit tough because your time with your new psychiatrist or your new primary care doctor is very limited. And sometimes it takes a lot of time to figure out, okay, where are you in this cycle? Are you coming off of a manic attack? Are you starting to become manic? Are you coming off a depressive attack? And if somebody sees you for the first time and only spends about 15 minutes, there are questionnaires you can do to shortcut, but you have to build that rapport with your caregiver to have them, using their knowledge base, learn about you. And sometimes a 15-minute evaluation isn't long enough to figure out, okay, here's your timeline when you were a kid, this is what happened until you became an adult, and this is the trigger. And from this point forward is when things kind of waxed and waned. Again, sometimes it's very obvious, sometimes it's not, but that's what you need a caregiver team for, is to figure out. You have to have a captain like myself to help figure out where you will best be served if you go to a specialist, or what I consider coaches as far as exercise, nutrition, mindful practice, or sleep. And usually we'll have to accumulate a team of people who care for you and give you the biggest bang for the buck. You have to get to the point of balance. You have to get to the point of a healthy lifestyle, proper sleep. And you can't just deploy one pill and expect that everything will turn around overnight. It's usually figure out what your roadblocks are, implement the path to success or a goal, I like to call it a summit, and then expect that you'll have blocks and or speed bumps here and there. But if you anticipate what your speed bump will be, you should be able to figure out how to get around the speed bump or survive the speed bump, and then move forward and continue to attack your summit. So hopefully this gives you a couple of ideas. Be careful if you're not sure if you're bipolar. If you do have some symptoms of mild anxiousness or mood disorder like depression, seasonal affective disorder, I think it would be worth it to try this as long as you don't take any medicines. Oh, final warning, if you are on medications, this can sometimes, especially if it's a serotonin reuptake inhibitor, SSRI, like Zoloft, Paxil, Prozac, Effexor, or Cymbalta, sometimes taking this can put you into a serotonin crisis. So I don't want to talk about that right now, but that's why it's very important, if you are on medicines, to be careful about what supplements you're going to attempt to try. So as far as using this and other supplements, you're okay. Sometimes this and St. John's wort would be a little complicated, but this and vitamin D, this and magnesium, this and other things like marshmallow root for the gut, or you should be okay. So please put any questions in the comments section down below. Or consider subscribing to my YouTube channel, because I put videos out like this to empower you to make changes, both in medicine and or herbal life. And I'll see you at the next video. Thanks for watching.